You ever get that feeling that lately everyone's getting sick? You, your friends, your colleagues. It just seems like coughs and colds are everywhere. But is that feeling the reality? Well, we're going to dig into that today and separate what we think is happening with health in Malaysia from what the data actually shows.
Here's how we're going to break it all down. First, we'll look at why it feels like we're getting sicker. Then, we'll dive into the official health report. After that, we'll take a peek inside Malaysia's healthcare system, pinpoint our biggest health challenges, and finally, wrap up with what this all means for you and me.
All right, let's start with that feeling, the public perception that we're all just not as healthy as we used to be.
This comment from a Malaysian Redditor probably hits close to home, right? One minute it's blazing hot, the next it's a downpour. It's such a common thing to hear, and honestly, it makes a lot of sense as to why we might feel under the weather.
So this is the big question, isn't it? If you've been wondering this yourself, you are definitely not the only one. It's a real concern for a lot of people, and man, there are a ton of theories out there.
People have a lot of ideas about this. That crazy weather is a big one. Some folks think our immune systems are just weaker after all those lockdowns. Then, of course, there's our diet, all that glorious fast food. And yeah, people are still talking about the long-term effects of COVID, vaccine side effects, and just general worries about the quality of our air and food. These are all the things we're hearing. Okay, so that's what we're all thinking and feeling, but now let's switch gears and look at what the hard numbers say. This is where we pivot from perception to the actual reality on the ground.
To get the real story, we're not just guessing. We're going straight to the source, the Ministry of Health's own annual report from 2023. This is the official nationwide breakdown of our health.
First, let's get some scale. In 2023, Malaysia's population was about 33.4 million people. So just keep that huge number in mind because all the stats we're about to see cover this entire diverse population.
And here it is, our first major aha moment. While we're all worried about catching a bug, look at what the data says is actually the biggest killer. At number 1, diseases of the circulatory system, we're talking heart attacks and strokes, make up over 21% of deaths. The infectious diseases we worry about every day, they're way down the list. That is a massive difference between what we perceive as the threat and what the reality is.
If this is already giving you a clearer picture, do us a quick favor and hit that like button and subscribe. It's the best way to make sure you always stay ahead on Malaysia's biggest issues.
So if those are the real dangers, what kind of system do we have to fight back? Let's take a look inside the engine room of our nation's health, the healthcare system itself. And let me tell you, it is a huge system. In 2023, it was fueled by a budget of 36.3 billion ringgit.
That budget helps run 149 Ministry of Health hospitals all across the country.
And all those hospitals are staffed by an army of over 136,000 doctors, nurses, and pharmacists on the front lines. So the bottom line is, the resources are definitely there.
So we have this massive system in place. But what are the biggest challenges it's actually facing day to day? This is where the real fight for our nation's health is happening right now.
Now, don't get me wrong. Some of those communicable diseases are a problem. Just look at measles. The rate didn't just climb. It absolutely skyrocketed in a single year. It's a pretty stark reminder that we can't let our guard down against diseases we thought were a thing of the past. But, as serious as that is, the data keeps pointing to a much bigger, much quieter crisis. Non-communicable diseases, or NCDs. These are the chronic ones, often tied directly to our lifestyle, what we eat, how active we are, and our daily habits.
In this chart, wow, it just lays the problem out there. Almost 37% of people screened were obese, and another 35% were overweight. If you add those up, that's more than 70%, a staggering majority, of those screened falling into at-risk categories. This is the stuff that directly fuels those circulatory diseases we saw are the #1 cause of death.
Okay, we've looked at the perception, the reality, the system, and the challenges. So let's bring it all home. What does all this information actually mean for us? It really boils down to this simple comparison. Our perception, our daily worry, is focused on catching things like a cold or the flu. But the reality, backed by all this data, is that the real monster under the bed is the rise of chronic, lifestyle-related diseases.
So if you just remember 3 things from all this, make it these. 1. Our biggest health threat isn't the flu season, it's chronic diseases. 2. That stat about over 70% of Malaysians screened being overweight or obese, that is a massive red flag. And 3. Our huge healthcare system is being stretched to its limits managing these long-term and often preventable conditions.
Thanks so much for sticking with us. If you want to be part of a community of informed Malaysians who want clarity, not confusion, go ahead and tap that like button and hit subscribe. Let's keep making sense of it all together.
And we'll leave you with this one last thought to chew on. The data shows we have this massive, well-funded healthcare system ready to help, but it also shows our biggest problems are tied to our daily choices. So the final question is really for us. What is our individual role in building a healthier Malaysia?